The views and opinions expressed on the Healthcare Advocate Show do not necessarily represent the views and opinions of Connoisseur Media or its advertisers. It's Revolution Healthcare, the show that keeps you in the know about the ever-changing healthcare system. We all need answers to our many questions about health and the revolution in healthcare. Presented by Patient Advocate for You, making sure that your healthcare is coordinated properly. And now, here is Sharon Gauthier taking your calls and sharing information. 1-888-574-2723. 1-888-574-2723.
Good morning, everybody. Nice, happy Saturday morning. The weather's really good out there. You know, people who know me know that I am always late, and I can't be for the radio show. So rushing over here this morning, I went through the Dunkin' Donuts that happens to be next door, ordered coffee, water, paid for the guy behind me, showed up here with my water and no coffee. So when I leave here, I'll have to go back and get my coffee again. So I'm very happy this morning to have some guests, but I wanted to talk a little bit about flu season coming up. Flu season is getting close. Almost means time for you to get that flu shot. Good news, a better, safer, more effective shot is available called Flu Block. You know, right in our backyard in Meriden is Protein Sciences that I really didn't know anything about until a couple of years ago when I met Dr. Minot Cox. Dr. Cox is a lovely, lovely woman from Holland, and they developed a flu vaccine called Flu Block. It's a licensed flu vaccine that doesn't use eggs, antibiotics, or the influenza virus in any part of the process of manufacturing it. For me, that was huge because I have mostly an elderly population. So we really recommend this product, especially for our elderly, but for anyone. In fact, every year we set up several flu clinics around the state. So I wanted to mention to you the flu clinics that we have coming up in October. Our first flu clinic, and we're going to put this up on our website. Our first flu clinic is October 2nd at Benestar, 10 Tower Lane in the group of buildings that I'm in on the first floor. That's coming this week. It's 11 a.m. to 2 p.m. All you need to bring with you, folks, is your insurance card. It's covered by most insurances. If it's something that you don't have insurance for, the cost is $40. On October 6th, we will be having our second that we're sponsoring with Protein Sciences and Health at Home, which is a group from Rocky Hill, the urgent care clinic that's in Rocky Hill developed a program called Health at Work. I'm sorry, not Health at Home, Health at Work. And they also partnered up with Protein Sciences for the flu vaccine, and they have a mobile unit now. So on October 6th, we will be sponsoring with Protein Sciences Berkshire Hathaway, 172 West Main Street in Avon from 9:30 to 11:30 a.m. On October 16th, we will be at White Oaks, which is an elderly community right on Deming Street, 230 Deming Street from 9:30 to 11:30. Always Best Care on 135 Center Street in Manchester on that same day, October 16th. They're a non-medical home care agency in Manchester, and we will be there from 12:30 to 1:30. And again, I'll make sure that's up on our website. This morning, I'm very happy to have guests with us, one of our sponsors from Home Helpers. Home Helpers is a relatively new franchise in Connecticut. I have three gentlemen that we met with before we started the radio show that we really bonded with, and we're very happy with their passion for what they're doing. Our particular company works a lot with non-medical home care agencies, and we're going to talk a little bit about this basically unregulated industry that has blown up across the country, including Connecticut, with sharing and providing services that they really shouldn't be providing. They are non-medical, and what I was impressed with Home Helpers is that they're also connected with Direct Link, which is like a 24-hour monitoring system, the kind of I fell and I can't get up service. And the three gentlemen that I have here today is Kurt Glaser, and he will tell you what area that he covers. I also have Peter DiMaria. He will tell you the area that he covers. I know that Peter covers up in Enfield. Kurt is up in the Canton-Farmington area. And then we have Sharad, who's in the Wallingford area. So welcome. I believe, Peter, you're going to be our spokesperson this morning.
Well, thank you. It's very nice to be here, Sharon. Appreciate the opportunity to chat about this industry and how we can make a difference.
Excellent. So why don't you tell me a little bit, because I was very impressed when we first met about the reasons why you actually got into this.
Well, each of us have different reasons, and I'll let Kurt and Sharad share theirs, but for me it's personal. I took care of my aging parents who wanted to stay at home. It was a privilege to take care of them. And we actually had a good experience having a home health aide come in and give us respite. We bonded with her. She became a trusted friend of the family. And as I was looking for something to do, there's always this passion to help the elderly and to give a good experience to the people who are, feeling uncomfortable, to make it as comfortable as possible, keep them in control, keep them at home, which was very, very important to my family. And home helpers share that same vision. You talk about unregulation of the industry. We picked home helpers because they're extremely strict about the quality of care, the training of the caregivers, background checking, drug testing, continuous education. They're very serious about putting someone in the home and making sure they're insured, bonded, and well qualified to take care of someone's loved one.
Well, and that is a big issue. People who know me, I have a really big pet peeve about the agencies out there that aren't really following the rules in the state of Connecticut and utilizing this registration, which really that's what it is with Consumer Protection Department and not the Public Health Department. It's nothing more than a registration, and not to downplay the fact that the agencies have to somehow be recognized by the state. But licensing and registration are totally different. And if you could explain a little bit about that registration process, I think that I can then get into the difference between that and what licensing is.
Well, you bring up a good point, because in the state of Connecticut and other states around the country, it's just purely paying your fee, registering, and filling out some forms, and you have the right to provide care in someone's home, versus licensing, which you'll touch on being a little bit more strict. So to keep Sally Smith from starting an agency by paying her $300 whatever to the state of Connecticut and saying she's licensed, that's a big mistake, because she is not licensed. She just has the right to put someone in the home and then go from there. We take it much more serious than that. It's that goes back to the training process, the experience that they have. We encourage CNAs to apply. We make sure they have experience. CNAs are certified nurse assistants. We have a couple of nurses that are available for assessments when we have someone that has a little bit more than just homemaking or companionship needs. We make sure that we pick the right person, personality-wise, skill-wise. They are bonded and insured, as I mentioned earlier. A lot of things that Sally Smith Caregivers, Inc. Doesn't necessarily have. They're bonded. They're on RW2. We take care of the taxes so that in a situation where the individual has someone in the home, they're not going to get in trouble with the IRS or the state of Connecticut that they're not holding the taxes for the person. So everything is above board. It's all taken care of. It's carefree to the family. And with Direct Link, if you can't afford to have someone there 24/7 for a small fee per month, we monitor, as you mentioned, the person in the home for their mobility. If they fall and they can't push the button in 10 seconds, we automatically call the first responders to be sure that you don't hear the story about mom being at the bottom of the stairs for 4 hours or a day and a half. So much more serious about taking care of people at home than the Sally Smith Caregivers at Home, Inc.
Well, and I'm glad you brought that up, because I do think that when people call us all the time, first of all, wondering if Medicare pays for this. And unfortunately, Medicare is not a proactive type of coverage. Medicare is crisis only. So Medicare, for people who have it, will cover a crisis that happens and not prevent a crisis from happening. So if someone does fall, fracture a hip, goes into the hospital, and they need to come home with some help, they will get a referral to a visiting nurses group, which is usually a nonprofit company, that will then be paid for by Medicare, where the nurse will come in usually 2 to 3 times a week. But it's for a short period of time. The aid that they provide is strictly only for bathing and personal needs. So that aid that is paid for by Medicare under the agency is not an aide that's going to come in and do the shopping, do the cooking, do the washing, which is what a lot of people need. And they're also not going to do anything with medications, which we can talk a little bit about in a bit, because that's another one of my pet peeves is medication management. So the general public doesn't understand that insurance is there, yes, and it will cover some help, but it's minimal. The most I've ever been able to get an aid from a visiting nurse association has been maybe 2 to 3 times a week for a couple of hours, and there's no continuity. So because aides are such a difficult position to fill, and we can talk about the challenges that you guys run into with that, what I find is that they will get somebody different every single week. And that's a problem for a lot of people, especially when you're talking about personal care, because you're bringing people in the shower, you're taking their clothes off, you're involved in their bedroom, you're exposed to their jewelry, their money, their personal life, which you have to really develop a relationship with someone, right, in order to continue sharing that. I'd like to tell our listeners that you can call in with any questions. Our number is 888-574-2723. Please give us a call with any questions. We're talking today about non-medical home care agencies, which are called home care agencies versus home health care agencies. I wanted to talk a little bit more about the health care piece of it. So the difference between a home care agency and a home health care agency is the medical management of it, correct?
That's right.
So what I have found in the last year that has come my way from people asking questions are that there are companies out there who have registered with the Department of Consumer Protection, because that's where homemakers and companions are registered with. And it's only a registration. They don't ask you anything more than send them a check and tell them the name of your company that needs to be registered and what the regulations are for that, which is basically, if I'm correct, is to have a contract with the family to do a background check, right? Mm-hmm. And to do what else is required? So you have to do a background check on your employees. You have to have a contract with the family, and there has to be
a care assessment or a care plan.
Care plan in place. So when you talked about having a nurse come in to do an assessment for you, your nurses are not employees of you. So that keeps them from being a part of your company, which keeps you as a non-medical home care agency.
That's correct. We use them more as a consultant to provide a little professional observation of the care that's required. They are used as a consultant, and then also we do tap into some of their talents and skills to help us select the caregiver that has the experience and level of skill that a client might need. It may not just be the companionship. It might need, the bathing, as you mentioned, or the reminding of medication, or some other skills that might go a little bit beyond of just sitting there and watching, Wheel of Fortune with them.
Which a lot of them do, or on their telephone. So I'm not, I don't really care that there's a non-medical home care agency that has a nurse that's not an employee. I think that makes sense to be able to subcontract with a registered nurse or an LPN, although LPNs are extremely limited because they're really under the direction of a registered nurse that can come in and help out. My peeve is that there are companies out there that I will refrain from naming because there are so many who have registered with the state, with the Department of Consumer Protection, hired full-time nurses to come in, stating that they're there only to supervise the aides, which there's no reason to have a registered nurse supervise aides that are non-medical, and they kind of protect themselves thinking that, well, that's really all we're doing. But it gives them a leg up with the other agencies who are doing it right, because this is what happens. When people leave the hospital, you will have a discharge planner who will say to them, your mom's going to need to have 24-hour caregiver. So most of the time when, and you can correct me if I'm wrong, most of the time when people contact you, they're in a crisis, right?
Yes. That's correct.
Right. So mom's in the hospital, discharge planner says you can't leave, they need 24-hour care. They go on the internet and they start getting all of these places that have aides. When you look at some of these sites, you would really think and swear that they were medical management sites, and they're not. So you need to look for the registration number. It is not a license number. They can't say it's a license. It's a registration number. So your registration number is an HCA number, correct?
That's right.
Right, and from the Department of Consumer Protection. So for those of you out there who are saying you're licensed, you are not. Secondly, you cannot provide any nursing services. You cannot say that you have a registered nurse that works with you. You cannot do that. It is against the law. You cannot have someone who's going around and putting medications together, right?
That's right.
So the aides can certainly give medications to someone that are pre-poured, but the agencies that are out there having registered nurses that work for them that go out and put those boxes together, you're doing it illegally. That nurse cannot work for you full-time, part-time, in any way at all if they're an employee. Now, again, like you guys have done very legally, is you can subcontract with someone that comes in and they can provide that service because they are working independently. They're not part of your company. And that's a totally different skill than having a non-medical home care agency that is providing that service for them, which is a big needed service. I mean, I do agree, as I'm sure you do, Peter, in that medication management is probably one of the top things that people call you about.
That's correct, and that's why on the direct link piece we do have a system that does medication reminding. It doesn't actually dispense or provide the medication to the client. It just reminds them to take medication. And to your point earlier, when you're released from the hospital, and they do have a medication regime, if you're forgetting it or not staying current with it, that could be a readmittance into the hospital for not taking medication. So these are ways of prevention, preventing a crisis coming, and that's what we're all about, is keeping the person at home and preventing them from having to return to the hospital.
And it's really a partnership, as I've always said to everyone when people call us. We don't do it all. We do what we do very well, which is coordinating, but we partner up with lots of people, and Home Helpers happens to be a group along with several others that we partner up with in order to help with the process of keeping people home and getting them home. Transitioning them out of the hospital still is a very complex process because I have a person in the hospital right now. She was in the ER for several hours. She then went up to one unit and was in observation, and then she went across the hall for a admission. So she's had several nurses with her and ended up with a personal caregiver with her that she had had prior to being admitted, because we felt there was a need. She has dementia. She's not a self-reporter. And that challenge for me, which continues across every hospital that I enter, and I actually made a nurse cry on Thursday when I talked to her about this, is that people aren't getting out of bed. You know, they go in, they sit in that bed. If they have dementia, there's no process at all in hospitals right now to identify people with dementia. There's not a lot of training that goes on. They may have a geriatric, like this particular nurse said she went to some geriatric workshop. I think that's great. They're starting to look at it. But as you all know, dementia can be presented in so many different ways. Mm-hmm. And I'll tell you a quick story about one of my dementia people that was home who's now in a memory care unit. I had a couple that lived out in Manchester, and there was a company that was providing 24-hour care for them. She was a little spitfire, little Italian lady, and she never stopped walking. And she was very verbal, but extremely hard of hearing. So I had gotten a call one weekend from the agency saying that she was being very combative. I'm like, well, why is she combative? I don't know. The aide's having difficulty with her. She's got lots of experience with dementia. Can you go over? So I go over and I sit and watch for a bit. And what was happening is that Susan, which is not the name of the client, would go in the kitchen and get a can of soup. My staff keeps saying to me, if I hear this can of soup story one more time. But it's so indicative of how training and exposure is different. So she gets this can of soup. She brings it into the living room and she gives it to the aide. The aide takes the can of soup and says to her, and the woman is deaf, very, very hard of hearing, excuse me, I don't want the can of soup. And Susan says, take the can of soup. And the aide said, I don't want the can of soup. So she created this action that made the the client very agitated. So I sat next to the aide and I said, just take the darn can of soup. So she took the soup, we put it down, and then I started an education process with this very young nursing assistant or home health aide, and stating, look, you may have had a lot of exposure and been with a lot of people with dementia, but every dementia patient is different. And I am going to have someone from St. Francis Hospital who have offered their expertise to bring on and talk about dementia and Alzheimer's, because it's a huge problem in our industry. And I would bet, Peter, that a lot of the clients you get have some dementia component.
Absolutely. And before they even go into the home, we do training, and part of the training is the basics of dementia and Alzheimer's. And your story is a very good one, because certainly you don't want to agitate someone who has dementia or Alzheimer's. And we've also found that when they do change, it may be something else going on. More than once, we've had a urinary tract infection that just makes them go a little off the normal road that they're on. So we want to be very conscious of the fact that something else might be underlying their behavior, and make them feel comfortable and not agitate them.
Well, this same woman, now that you mentioned the urinary tract infection, so there was a little bit of training that went on, and I did say to the home health aide, you will never win an argument with someone with dementia. Take the can of soup, put it down. She'll forget that she gave it to you. She may go back and get something else, but you need to go to their place, right? You can never bring them to your place because they're not in that place. And the same aide, when this person asked her where her mother was, the aide said to her, your mother died. So I had to go over another time with now a client who was crying hysterically because she really felt that her mother had just died at that moment. So those little things make such a huge difference, that the training of the aides, as you said, is extremely important, because every client is different. Her husband had dementia. He basically sat at the television. You told him what to do. He's like the perfect husband. Told him what to do. He did it. He didn't remember what you told him. He had a different kind of dementia. That same woman, a couple months later, I got a call from the aide. She's now in a memory care unit, this woman. So I got a call from the aide saying she went downstairs and got an axe. So she calls me quickly, and I'm like, well, get the axe away from her. So I go over, 7 o'clock at night. Behavior was quite different. She was really mad because her husband wouldn't change the channel and the channel changer. I always knew, guys, that channel changer would be a problem in life. So we brought her to the hospital, and it turned out she did have a urinary tract infection. That behavior, even for her, was a little different. We had a hard time explaining the whole axe thing to the ER, but because they knew me, we reassured them that we were going to hide and put away any knives, axes. There were no guns in the house. But that was a firm example of someone with kind of a difficult side of dementia, very hard of hearing. So listen, if you're hard of hearing, my mom was hard of hearing. She just nodded to everything. Nobody ever wrote anything down for her when I would go down to Florida and they would talk to her. They're talking to her loudly. Well, listen, there was a doctor that I worked with on the neurotrauma unit. I will never forget Dr. Cortez, God bless you wherever you are, who came from Colombia. He would go in and speak to people who were of another language, and all he would do is speak louder. So I would go in and say, they're not deaf. They're speaking another language. We all tend to do that for people. And the same thing with people who are deaf. So I had to do a lot of training down in Florida with my mother's staff, in that they just had to write everything down. We had a computer. If they wrote it down, she could read it, so that you're not yelling at people all the time. So you do provide that training. And we did talk a little bit about the licensing versus the registration piece of it. Again, folks, if you want to call and talk to home helpers about non-medical home care, you have comments about non-medical home care versus home health care, please give us a call at 888-574-2723. So I want to talk a little bit about what home health care is, which is a little bit different. Home health care is a licensing process through the public health department. Mm-hmm. What they provide are nursing skills, which is medication management, assessments, being able to evaluate what's going on, take orders from a physician. They're also the nurses in these visiting nurse associations that are the first contact with the client, and when they go in, they assess what their needs are. So first contact with that registered nurse, and it's only a registered nurse who can do that, will come in and assess what their needs are. They're the ones who are the trigger pullers. So they'll trigger in or pull in what resources they need. They may decide they do need a 24-hour caregiver versus the maybe 2 to 3 times a week that there is an aide provided by them. They'll bring in physical therapy. They'll bring in occupational therapy. They'll bring in speech therapy. They'll bring in the social workers that come in. We presently don't have a visiting nurse association that is a sponsor of ours, but we're hoping in the future we will get one so that they can talk a little bit more about the services that they bring and the things that they don't bring. So there's a distinct difference between non-medical and medical. And what I like about, again, home helpers in Connecticut, that they make life easier. They're involved with Direct Link. And I want to talk a little bit more about Direct Link, is that they do follow the rules, as many other companies also do follow the rules. And I honor those companies and use those companies who follow the rules, but they're really at the mercy of the companies who don't follow the rules. And that concerns me because, as we all said, it's a crisis that usually is generated around the need to have a home health aide. They go on the internet, so they pull up a company with the same HCA number registration as you guys have that has nursing. We do medication management. We'll have a nurse that will come out and see you. Clearly, it says to the family that they're medically managing. And then you have another agency who's doing it the right way, who says, we are involved with activities of daily living. And I'll have Peter explain a little bit about what that is, which is clearly what homemakers and companions do. They don't get involved with medical management. They don't make decisions. They don't put together medications. They may go to an appointment with someone, but they're not the ones who are really assessing the needs of that person. So activities of daily living. Let's talk a little bit about homemakers and companions. That's exactly what you do. And what is that, Peter?
Well, to do the activities of daily living, we're helping the individual with the basics of everyday life, the eating, the toileting, the transferring, just making their lives easy to proceed throughout the day. So it's not the medication that you're talking about. It's more just making sure they're nourished, keeping them in companionship, that they're clean and bathed and in a very sanitary, safe environment.
And their laundry's done for them. And Sharad, you had a comment?
Yeah, in fact, just to add to what Peter said, so sometimes you have clients who are in bed. They can't get up out of the bed by themselves. So it involves, getting them out of the bed, or even bathing them while they're in the bed because they just can't get up, they can't stand, they can't sit. So, yes, bathing, dressing, grooming, it's not only having them move to a shower to do that, but also
if they're bedbound. Which, right now I have a Parkinson's patient, and I believe, Peter, was it Peter? Was it? Yes. No, Kurt. It's Kurt. Gosh, I keep getting these two guys mixed up. Kurt and I were trying to get them involved with this client, and they ended up, she's a Parkinson's patient who's bedbound. They ended up hiring someone who is not from an agency. And here's the problem, which I will have Peter explain, in hiring a private person that's not with an agency. What are the issues with that?
Well, this is Kurt. There's a lot of issues. First and foremost is you want to take care of your parent. And if you have an independent person there, inevitably somebody's going to get ill, they're going to get sick, they're going to have a personal issue and they won't show up, and then your parent's not taken care of. So we have backups readily available to bring in at a moment's notice. And also, as Peter mentioned earlier, we do background checks. Do you want somebody in your house that hasn't had a background check?
Correct.
We background check for 7 years in 50 states. So we know that these people will be in a safe environment. We're confident, and we do training. And we also are personally involved with each client. We do a care plan, and then we do an assessment. We're always back, spot checking, and making sure the duties are being done, and the caregivers there doing what we're asking them to do. So you get all those benefits working with an agency. Going direct, you miss all of that.
Right. And the risk for that is really liability. So when I say to families, which I did with this particular family, it's fine if you want to hire someone privately, but just remember that the liability piece of it could be a problem. So you need to talk to your attorney. You need to talk to your accountant in order to make sure that you have workman's comp for them. Because the other piece of it is this is not fair to that caregiver because they're working there, and if something happens, they can't go and collect unemployment because that's not been paid for them. If they get hurt, they have no coverage under workman's comp. And I always say everybody's your friend until they get hurt. And if they're driving your car, that's a problem, and they get into a car accident. So I would caution everybody. Certainly, we know the cost of it is often less money. It is very costly, which we'll talk a little bit about what the costs are in hiring from an agency. But at the end of the day, the price that you pay versus the cost that it may cost you on the other side may balance itself out. And that if, in fact, you're going to get someone who doesn't show up, who steals from you, who ends up getting hurt, and you end up in a huge lawsuit over it, do you want to risk all that? And, again, people are in a position that they need this right away, so they shouldn't be running around looking for somebody privately without knowing all that. Yes,
Sharon, if I can just add, too, even if you do that and you're having a wonderful year and there's no accidents, nothing's been stolen out of the house, and then all of a sudden Uncle Sam knocks on your door and saying, where's the Social Security taxes that you took away from, escrowed for this individual? Where's the withholding taxes? And before you know it, you have a situation with the government and the Internal Revenue Service that you have not taken care of all the taxes and FICA that is required of hiring somebody in your home.
And I think you brought up another very good point. So far we've talked about how the family is the center of the care. You want your loved one to be taken care of, but I think you brought up a very good point where it is also about the caregiver. You got to think about the caregiver. So when you said, Sharon, that, private caregivers don't have workers' comp, and a lot of the clients require transferring, lifting, and it's easy to for the caregiver to get hurt. Agencies provide workers' comp. So as you said, if a caregiver is hurt and they require medical care, workers' comp covers some of that medical care for them. So
correct.
Because you want them to be able to get well, get back to a job that they can then serve. So you do have to think about the caregivers as well.
Right, and this particular client is bedridden, and now what they're doing is they're actually picking her up and lifting her, to get to the bathroom. So they are at risk for that, but I made the family very aware of that. So, all we can do is educate people, and they can make their own decisions. But again, people, I would caution you, please be careful when you go out there. Like we all said, this is totally an unregulated industry. I think that will change next year. We spoke to Peggy Sayers last week, who's from the legislation. She's a registered nurse. This topic has been brought up more than once. I actually met with Jonathan Harris, who's the Commissioner of Consumer Protection, and his fraud department, and his assistant, Commissioner Michelle. And we had a long discussion about this because this often comes my way with questions from families or even hospitals or entities. So yesterday I was at the Atria in Rocky Hill, and the marketing director over there gave me a card of someone that the priest actually gave her. So, how would you not trust that from a priest? But she was a little concerned because on it said that they were licensed. On it said it was a registered nurse who was the administrator. And what did they really do? Because when you turned the back of the card over, it looked as though that they were a homemaker and companion. So she asked me if I could look into it. And I did. I called them to get information. And it turns out that the nurse that is the administrator there, does go out and pre-pour medications. They do have nurses on staff. So it's totally not legal, and nobody knows it. What the Consumer Protection Department said is, look, we're a registration, and I know that people try to define themselves between a registration versus an agency, and I'll talk a little bit about that. But basically, everybody is just registering, and that registration is not a licensing, so there is no process that they're looking at you, that there's regulations to follow, that you're being monitored. There's none of that goes on. And if they're providing any kind of medical care for you, no matter how minute it is, and if you go into an agency that has an HCA number, it is a registration, it's not a license, and they should not have registered nurses on their staff, period. They can subcontract out that are 1099s, but they cannot have anyone on their staff. Please give us a call, folks, at 888-574-2723. We're with home helpers from 3 different areas in Connecticut right now. We have Kurt Glaser, we have Peter, and we have Sharad. And I'm going to have them tell us what areas they cover. So, Peter.
Yes, this is Peter DiMaria. We cover the north central part of Connecticut, so that's the Somers, Suffield, Ellington, Stafford area, pretty much along the border with the Massachusetts. It's a area that I lived in for all my life, so I'm tethered to that area, know it very well, and that's the place that I cover. And then Kurt.
Hi, this is Kurt. I cover from New Hartford all the way up through Enfield and the Windsors, down through Simsbury, Avon, Farmington, West Hartford, down through Unionville. So kind of the heart of Hartford County.
Yep, and Sharad.
Yep, this is Sharad. So I cover all towns, you would say, on the corridor of Route 8, come down to Waterbury. So starting from Winstead all the way down to Waterbury, and then come further down to Cheshire, Southington, Wallingford, all the way down to New Haven. We do have some towns on the sort of east side, Glastonbury, Haddam, Middletown, but that's the area that we cover.
That's the basic area that you have. So, everybody, this is the Talk of Connecticut Radio. It's AM 1360. This is the Brad Davis radio that everyone met the other night at our launch party. You can go and get any of our shows to listen to our website, which is revolutionhealthcareradio.com. We download them every week. You can leave your questions there. I put this up on Facebook every week. We love to have your calls. We get questions that come in all the time. I wanted to talk just a little bit more now about flu season. I know people debate about whether or not they should get a flu vaccine. Do you guys get flu vaccines?
Already did.
Yeah. So, I am a big supporter of flu vaccines. And I met Dr. Minot Cox last year, and we became very involved with the new flu block that they developed right in our state from Protein Sciences in Meriden. They were also very involved with the Ebola that went on last year in trying to develop a vaccination for that. We're sponsoring because we really have a passion about needing to get flu vaccines. We are sponsoring flu vaccine clinics in 4 different areas, which we're going to post up on our website. But I just want to remind you that it's from Protein Sciences. They're licensed with this vaccine, does not use eggs, antibiotics, influenza virus of any part. So those of you who think you have a reaction to the flu vaccine, you will not have a reaction to this vaccine. We're pretty confident of that. If you're allergic to eggs, it doesn't matter. It's not made from any egg products. It's made from a protein. So I think it's pretty fascinating that we have someone right in our backyard, Protein Sciences in Meriden, who provide this vaccine for the state of Connecticut. I just connected them with Care for You Pharmacy, which is a pharmacy that we have also connected with, who are going to start distributing the flu block to their clients. So we're very pleased that we are connected with Protein Sciences. Our flu vaccine clinics are October 2nd coming this week at 10 Tower Lane, which is in the group of buildings that our office is in. It's at Benestar. They've been very gracious in giving us their conference room that has a huge table. So 10 Tower Lane on the first floor, 11 a.m. to 2 p.m. Just come on over with your insurance card. We will process everything for you. If you don't have insurance, the cost of it is $40. On October 6th, we will be at Berkshire Hathaway, 172 West Main Street in Avon. Between 9:30 and 11:30, we're going to be vaccinating all of their employees and anyone else who's interested in coming in. Nothing you need to do except bring your insurance card. We'll fill out the paperwork, and we will process it. October 16th, we have 2 of them. White Oaks, 230 Deming Street in Manchester. We actually have visibility at White Oaks. They will be there. We will be there from 9:30 to 11:30. White Oaks is an independent elderly community that provides resources within their building. They have their own home care agency. They also have a home health care agency, Interim, that we work a lot with, and that we will also have an office there, patient advocate for you, in order to help people with coordinating care. Always Best Care is a non-medical home care agency in the Manchester area. They will also be sponsoring with us a flu clinic from 12:30 to 1:30. Also on October 16th, 135 Center Street in Manchester, please write these down. We'll put them up on our website in order to have you guys get all of your vaccines. Many of you are required to get vaccines. Do you require your staff to get it, and do you get any resistance from that? And can we do a flu vaccine at your place, actually?
Absolutely.
Clinic.
And we do encourage our caregivers to get the flu vaccine, and if their insurance doesn't pay for it, we offer to pay for it for them.
That is excellent. Well, you know what? We need to talk because flu season is coming up, and I will talk to you about setting up flu clinics also at your places. And, we're providing this as a free service. We provide our nurses that will provide the inoculations for them. Susan Manganiello is the person who's in charge of this at Protein Sciences with Dr. Cox. It's a very easy process. We come in with the coffee and the donuts. People come in, they fill out their paperwork, they have their insurance card. It's great. So today we're speaking to home helpers, Kurt Glaser, who's an owner, Peter DiMaria and Sharad Saxena. Is that how you spell it? Or talk about it? So I was going to talk a little bit more about the regulations with the state of Connecticut. And I wanted to read a little bit from the law because I pulled up the regulation from the Department of Consumer Protection. And anybody interested in this, just Google Connecticut, State of Connecticut Homemakers and Companions regulations, and it will bring you right there. So the regulations are clear that the agency, homemaker companion agency, place an agency on probation or issue a letter of reprimand if they conduct the agency of a character likely to mislead or deceive or defraud the public. So I'm really concerned about the agencies that are defrauding the public, and they're deceiving the public when they're telling them that they can have a registered nurse on staff that will do medication management. Now, when I've had conversations with a few of them, just kind of finding out why they actually went that way, they were very clear that the only reasons those nurses are there is to supervise the aides. And my answer to that is you do not need a registered nurse who's a clinical person to supervise non-medical people. So, in fact, if they want to do that, they can go ahead and do that, but they cannot use the term, which the term registered nurses in this state happens to be a protective term. I've been working a lot with the Connecticut Nurses Association that I've been involved in for years, and we're actually going back to the legislature last year to have this discussion. We want to make sure that the term registered nurse is protected, that people aren't using registered nurses in an improper way. And there's actually a company in Connecticut, which is a trademark company. It's called Nurse Next Door. And Nurse Next Door comes from Canada. Have you heard of them, guys? Yes. So the perception in our state, if you say Nurse Next Door, is what?
A nurse.
A nurse. And they're not. They're not nurses. I brought that to the attention of the Consumer Protection. They're still addressing it with them. Nothing against Nurse Next Door. I've spoken to the woman who happens to be the owner of it in Connecticut. I understand that it is a trademark name, but that's when we, as an association, the Connecticut Nurse Association, started looking into, can they use that term in this state? Because when you say Nurse Next Door, the perception in this state is that it's a nurse. Of course, they're going to go in and tell them they're not. But why are they allowed to use that term to begin with? I personally have a problem with that because I'm a registered nurse and I worked very hard to maintain that license, and I'm really not happy with a company that's coming into Connecticut. Now, when I mentioned this to the Department of Consumer Protection, when I met with Jonathan Harris and his fraud department, they weren't even aware of this. And the reason is, when people go online, they register their company, period. They have no information about them, nothing more than they've registered. So when I brought it to their attention, I know that they were going to look into it, but I don't think they can do anything about it because they're using the term nurse and they're not using the term registered nurse. So therefore, it's not a protected term, which we're going to try to get it to be a protected term. So these are the things that are happening that are really impacting your business. Because honestly, if someone is at the hospital and the discharge planner says, your mom needs 24-hour care, they're going to go on the website and Google, private homemaker. Nurse Next Door is going to come on, right? And they're going to think, oh, my God, it's a nurse. Even though they say that they're not, the perception is it's going to be a nurse involved. And that impacts your business, correct?
Absolutely.
Yes, it does. And I think more importantly, it's misleading to the client. that they're going to get more than what they really need.
Right. And when I actually called, this is how I found out about them. I was minding my own business, which I know everybody finds hard to believe, but I was minding my own business, sitting in a doctor's office, a urology doctor's office. I picked up one of the, I'm looking at the pamphlets, and I see Nurse Next Door. I'm like, great, what a great service this is. And I'm looking at it, and I see an HCA number, and I open the booklet, and it talks about nurses, medication management, evaluations, all these skills. So I actually called their 1-800 number, and they had said, yes, they provide all these services. I said, are you aware that that's not something that can be provided in Connecticut? And they then directed me who the owner is, and I had a very lovely conversation with her, and she wasn't aware of that. And they did take their brochure back for it to only say that it is a non-medical home care agency. But what they do, the company themselves, is that people aren't hired by them. They're all 1099s. And here's a 1099. Can you guys explain what a 1099 is?
Sure. A 1099 is somewhere where you actually do a contract with an employee, a potential employee or a consultant. So they're not on your payroll. So you pay them a fixed amount, per hour, per visit, per day basis. But the responsibility of, like Peter said, the taxes falls on the individual to sort of, deduct not only their portion of taxes, but also the FICA, the FUTA, and all that stuff.
Correct.
So you, by 1099 as an employee, you actually outsource all the responsibility of the taxes.
And it's also the responsibility of that person to be in charge of what they do.
Yes.
And that is a misnomer that I think a lot of agencies don't understand, that when you 1099 a person, first of all, they have to, because we've been round and round with this with our nursing staff and our accountant, they have to work for someone else. They can't only work for you, because if they only work for you, then they are your employee, correct? They also have to be independent, so you're not directing them what to do. So if someone 1099'd me as a registered nurse, they would tell me what it is that they have, and I would be self-directing myself based on my license as a registered nurse, knowing what to do with that client. And that's not what's happening with a lot of the agencies. They're not 1099'ing them, but they can 1099 them, but they have to remember that that person needs to also be working for someone else, because if they're just working for you, then they need to be an employee of yours. And like I said, I have many nurses, and I have one woman who's very part-time, and we talked about 1099'ing her, but she doesn't work for anyone else, so we had to make her an employee. And it is very costly. When I look at my payroll every week, it's like, oh gosh, but it's the right thing to do. It's the right thing to do for everyone, because then that person is covered, not only liability-wise for you guys, but also for the clients that you're dealing with, and they also are covered with workman's comp. So here are the client services agreements that the state of Connecticut expects to have homemaker and companion agencies to have. They have to have a written contract or service plan that shall be provided by the agency to the client, and a copy shall be kept by the homemaker companion agency. The agency shall not enforce the written contract or service plan unless it is signed by both the agency and the client. So that's very important for both of you, right?
Yes.
It needs to be an agreement between yourself and the client themselves. Written contracts or service plans shall, and these are the requirements of the state, provide a list of anticipated services to be provided to the client, the term and cost of said services, and a clear definition of employee, provider, client employment relationships, safeguards for securing personal client information, and a list of provider job categories as live-in or daily call and job duties. So can you explain a little bit about what that means as far as that contract is concerned? So you're assuring them, according to this law with the state, what kind of employee they are.
That's correct. We set that expectation up front. We have, when we do the assessment with whether we use the nurse or not, or just go there for what the services are, we agree between the client and our agency what services are to be completed and what time scale, and they sign off on that. An addendum to that is the agreement, which sets the terms and conditions of which we're going to operate, our pricing policies, our call-in policies, our weather policies if there's a storm. All that is pretty much accepted up front, so the expectations are very, very clear before we set a caregiver on the property to provide any services. So we're very clear about that. We make sure we have the emergency contacts that are required. We make sure that the caregiver knows if there's any do not resuscitate orders. We make sure that we've discussed all of that with the family. And it's very clear. We then will follow up after the first shift to be sure that everything met the expectations that were agreed to, make modifications if necessary, and continue from there.
So I think in short, that's the care plan, and it's created after a big discussion, with the family or the loved or the person receiving the care in terms of what they need. The other important aspect of that is we do go over the care plan with the caregiver, so the caregiver knows what's been agreed to with the client in terms of services, days of the week, is it every day, is it once in a week kind of a thing, so that they know what's expected of them while they are at the client's side. So. Right. All the parties involved in the care do know about that, about the care plan.
So you're following the guidelines of the state. And again, I'm reading this from the Department of Consumer Protection concerning the registration of homemaker companion agencies. And again, for those of you out there who are stating that you're licensed, you are not licensed, you need to indicate that you are registered. Now, I know there's this big debate between registries and agencies. Mm-hmm. So there are some registries out there, and that's where the 1099 comes in. So the registries are saying, well, we're a registry, which means they're not our employees. Families know that ahead of time. And the employees have their own tax ID number. So they assume that protects them. The problem with that, for me, is that if that registry is providing 24-hour care, that negates that person right there and then of being a 1099, correct? Because now they're not working independently, which means that agency cannot tell them what to do, how to do it, and who's actually in charge of them. It's the family.
It's the family. The family takes ownership of the scheduling, of identifying, when can a caregiver comes, and when they don't. If Susie can't come to care for my mom, it's their responsibility to find a backup for Susie. So in a registry, the family takes a lot of ownership and the responsibility of managing and providing care for their loved one. Yeah.
Which a lot of them, these registries, aren't explaining to families. Because, again, I will get those calls from families saying, I had no idea that this is really what I was getting into, because it's not fairly being explained. Now, the laws have changed a little bit about 24-hour care. So Peggy, Sayers, and I talked about that last week. Again, everybody, if you'd like to call in with a question, our number is 888-574-2723. Please call in and ask your questions. We have three very well-versed gentlemen here who are from Home Helpers, who understand the regulations and understand home care. And we will also have a link to their website on our website, which is revolutionhealthcareradio.com. So talk a little bit, if you can, Peter, about how the regulations are affecting you in terms of what people have to pay for care.
Yeah, we've been following the regulations for quite some time, and though there's been appeals in court of trying to change the regulations, we've ensured right from the beginning that we pay our caregivers at or above minimum wage. They have to be compensated for overtime, and even though there's been some exceptions to companion care, your point is well taken. Be careful, because there may even be a retroactive piece to the legislation that you might have to go back and pay overtime to people that you have not been paying overtime to. So, fortunately, being relatively new, we started right from the very beginning honoring the legislation, even though it's been back and forth on appeal. Our agency does follow the new regulation right from the very beginning. And from what we've been reading is October 13th is the date that it will be in effect. The appeals will have expired, so any agency that is not following the minimum wage rule could be in some hot water.
So it's minimum wage and overtime, and explain how that really impacts 24-hour care, because Peggy and I talked last week, the continuity is so important. And right now, I'm always assured when an agency goes in, they'll have somebody 24 hours, Monday through Friday, and then on the weekends, there's usually a relief. But now, that's going to cost families a lot more money.
That's correct. And I spoke to the Department of Labor in Connecticut and asked them what their position was on the legislation. And they basically told me that they are following the federal rules. So That said, it's $9.75 per hour is the minimum wage, and anything over 40 hours per work week, has to be paid at time and a half.
Right.
So I think your question about a live-in caregiver comes into the picture because a live-in caregiver is caring for a client 24 hours a day. So the 40 hours work week fills up pretty fast. It could be in 3 days you filled up your 40 hours. Now, the regulation also allows for downtime of the caregiver. So the caregiver is able to sleep in the night because of the required care is not that intensive.
Right.
You don't take that 8 hours of sleep into account as having worked.
Oh, okay.
So of the remaining 16 hours, we're still sort of figuring out how the sort of regulations will be implemented. But you can potentially take out time where the caregiver is not caring for a person. They may be doing their stuff for, 2 hours, doing nothing else. You can take that time out from saying, this is time that you haven't worked for the client. But as Peter said, once you sum up all the hours worked caring for a client, could be doing anything, doing his laundry, washing dishes, doing light housekeeping. All that is considered work for the client. When you sum that up amount of work over a week and it totals up to 40 or more, as Peter said, you do have to pay the caregiver time and a half.
Well, it's very labor intensive, I would think, to even monitor that. So for the agency, not only are they paying time and a half that then reflects back to the families that have to pay more, which I'm going to talk to you a little bit about what the cost of that. We have about 3 minutes left to our radio show. And again, anyone wants to call in, 888-574-2723. The cost of that goes back to the family. And that is something that we really need to talk about in this country because we're all approaching that age that many of us don't have long-term care insurance. I'm fortunate enough that we decided to get that. So they're privately paying for those funds, and that cost sometimes can be upwards to $1,500, $1,800 a week. So when you talk about the rate, can you share with us about what your hourly rate is and 24-hour rate is and how that works?
Sure. I think without getting into specifics, I think we are, at least in the territory that I serve, our rates are slightly higher than what the state sort of average is for an hourly care. And for a live-in care, we are, again, a slightly bit higher than what the state average is, that they pay in the state. I think the hourly rate, state average across all similar agencies is, I think, around $20.
Correct.
For hourly. And a live-in is around $220. We are slightly higher than that. But that sort of assures the
$220 a day.
A 24-hour day.
Correct. And I think you're correct. That is the average out there that I see.
Yeah. Now again, I think as you said and we've talked about, there are times when it's all about the care that a person needs. So yes, by and large, our rates are higher than the state average. If it does help, we do sort of meet a family's financial needs as well as their care needs. So we are willing to come down on our rates if it means the family gets the help.
Thank you so much, guys, for coming today. You're listening to Revolution Healthcare Radio. You'll see us next week here between 11 and 12. Please visit the Talk of Connecticut and revolutionhealthcare.com. Thank you all. Have a great weekend.
Thanks.